already taken the Nclex PN and the Nclex RN. I passed both 85 questions, and now I just want to help you. Let me explain to you a study strategy that I utilize in order to help me on the Nclex. I call this method like my cluster method because I usually cluster together all similar answers, and then I pick the answer that differs from the majority of the bunch of questions that I've clustered together. Let's say there's a question and it asks you something to the effect, and you're not going to get anything like this, but if you were to, you're going to use this same pattern on other questions that are very similar to a multiple question like this in sense of style or formatting. So let's say you get a question and they ask you, what protein provides the highest amount of protein? Like which one of these meats provides the highest amount of protein? They're going to give you salmon, catfish, sardines, and beef. So they're going to ask you which one of those varieties of meats provides you the highest amount of protein. Now, you might think automatically beef, that's obvious. Now, that's obvious, but sometimes every single answer that they provide for you to be able to select from in a multiple choice question isn't that clear. But there is something very similar here that I want you to recognize, and I want you to understand why the clustering comes into effect in this point. So if you recognize by now, there's a pattern. So the sardines, the salmon, and the catfish are all fish, right? They're all seafood or fish products, right? And then beef is the only outlier, the only thing that doesn't quote unquote cluster here. So the correct answer would be beef. Now, someone might hear this and go, I don't understand it. I don't get it. What's happening here? So they're giving you several different choices there, right? They're giving you sardines, catfish, salmon, and beef. That's a total of 1, 2, 3, 4 questions or 4 answers that they're providing. Tell me, out of those 4, how are you going to pick? Are you going to try to go through and dissect and say, well, I know that salmon provides protein, sardines provide, amazing, like they all provide omega-3s outside of beef. Like all of them are very similar. So what's going to be the determining factor for you to pick the correct answer? And I want a light bulb to sort of switch for you to say, well, there's an outlier there. Beef is the only thing that's not the same. One of these here don't belong, and that is the correct answer. And I use the clustering method in a lot of other ways too. I have so many more methods that I use in order to be successful when taking the NCLEX and nursing exams, but this method, I feel like I used it. I literally resorted to this when I absolutely did not know the answer. I just used the clustering method and it worked every single time, even with disease processes, right? I think there's a question that comes to my mind, not on the NCLEX, but a question that comes to, or a scenario that comes to my mind. It asked about gonorrhea, UTI, bladder infection, or bladder cancer. And I used the clustering method because I was like, everything looks so similar. Nothing was super abnormal with the lab values. I mean, there probably was something in there besides the hematuria and the anuric episodes that the patient was having that should have prompted me to know this. But I recognized that the gonorrhea is an infection, the UTI is an infection, the bladder is infection. So which one of these don't belong here? And it was bladder cancer. That was the correct answer. And yeah. So as always, this is for your health, and I hope this helped.